Did you know that women are more likely to visit a doctor than men? Women are also better at maintaining screening and preventative care. Men are more likely to skip checkups, delay medical assistance, and ignore symptoms. When symptoms persist or certain patterns are noticed, it can signal something more serious. Today's video is all about symptoms like dizziness, excessive thirst, and constant fatigue that should not be ignored. Let's get started. First, dizziness. Dizziness is characterized by feeling lightheaded, unsteady on one's feet, or the perception of the room spinning around oneself. It is caused by inadequate blood flow to the brain, which can result from a sudden drop in blood pressure or dehydration. Dizziness is commonly associated with health issues such as the flu, allergies, or hypoglycemia, but it may also indicate serious medical conditions such as heart disease, stroke, or shock. Second, shortness of breath. Shortness of breath during daily activities should not be ignored. Although symptoms may vary, they should be taken seriously. For instance, experiencing shortness of breath after a light walk may indicate coronary artery disease, which is caused by complete or partial blockage of an artery carrying blood to the heart. Third, excessive thirst. Staying hydrated is good for you, but constant thirst may indicate a health problem. It's one symptom of diabetes, a metabolic disease in which raised blood sugar induces thirst, so you drink enough water to eliminate excessive glucose. Keep up with annual blood tests to assess glucose levels and monitor the potential insulin deficits of diabetes. If you have a family history of diabetes, you should have your blood sugar checked. Excessive thirst may also be a symptom of internal bleeding, infection, or organ failure. Fourth, bloody or black stool. Although bowel movements may naturally vary in color due to diet and medication, it is important to pay attention to changes in color such as pale, black, or bloody stool, as they may indicate a serious problem such as bleeding in the upper digestive tract. Bloody or maroon stool may indicate bleeding in the lower digestive tract, and frequent occurrence of this should be taken seriously as it could be a sign of hemorrhoids, bleeding, or ulcers. If you notice unusual changes in the color of your stool, contact your doctor right away. Fifth, frequent fatigue. A bad night's sleep or physical exertion can leave anyone exhausted, but fatigue for an extended period of time is a red flag worth a trip to the doctor. Prolonged tiredness can be a symptom of certain cancers and infections, kidney or liver disease, diabetes, and congestive heart failure. A sleep disorder is another possible trigger, as is a problem with the thyroid gland, anemia, and psychological conditions such as depression. Sixth, excessive snoring. If you or your partner are being woken up at night due to snoring, it may be an indication of obstructive sleep apnea syndrome. This condition can cause the snorer's breathing to be interrupted, leading to problems such as daytime fatigue and an increased risk of high blood pressure, irregular heartbeat, heart attack, and stroke. Seventh, persistent cough. Although most coughs will typically clear up within a week or so, persistent coughing may be an indication of a more serious underlying condition. Chronic infections such as bronchitis could develop, but coughs can also be caused by a range of common conditions, including asthma, acid reflux, and sinusitis. Additionally, certain medications such as ACE inhibitors used for high blood pressure may cause coughing as a side effect. It is recommended to see a doctor if you have a cough that persists for more than 3 to 4 weeks. If you smoke, don't avoid seeking medical attention out of fear of being told to quit smoking. A smoker's cough could be a symptom of COPD, a severe lung disease that can become extremely debilitating if left untreated. Other potential serious causes of coughing include lung cancer, blood clots on the lung, or heart problems. Eighth, frequent heartburn. Experiencing occasional heartburn is not typically cause for concern. However, if someone experiences heartburn at least twice a week, it may be a sign of gastroesophageal reflux disease, GERD. GERD can cause inflammation, bleeding, and ulcers in the esophagus and increase the risk of developing cancer or precancerous conditions. Ninth, trouble with vision. As people age, their eyesight often deteriorates. Regular eye exams are important to catch potential issues that may not be noticeable otherwise. Symptoms such as blind spots, blurry vision, tunnel vision, or seeing halos around lights can indicate concerning eye conditions. An eye pressure exam can help identify glaucoma as well as diseases such as cataracts, diabetic retinopathy, and macular degeneration. Vision problems can also be linked to stroke or the development of a brain tumor. 10th, swollen or stiff. Joints. Experiencing stiff or swollen joints can be an indication of underlying health problems. It can affect different parts of the body, such as the hands, feet, or knees. While it may be the early stages of benign degenerative arthritis or osteoarthritis, it could also be a sign of more serious conditions. These may include autoimmune arthritis, hormonal imbalance, immune system imbalance, poor nutrition, or physical deconditioning. 11th, skin changes. It is important to consult with your doctor if you notice a new freckle or mole with an unusual shape, or if an existing mole changes in size, color, or starts bleeding. These could be potential signs of skin cancer. Men are particularly at risk for this disease, especially if they spend a lot of time outdoors without sunscreen. Some forms of skin cancer can be deadly, but if detected early, it is often curable. 12th, frequent urination. Experiencing frequent urination may indicate underlying health issues. Diabetes can cause frequent urination as the kidneys work harder to eliminate excess sugar from the bloodstream. Prostate problems may also cause this symptom. Symptoms of prostate issues can include reduced urine flow, pelvic discomfort, and blood in the urine or semen. Enlargement of the prostate is a common condition among older men, but shouldn't be ignored as it can have symptoms similar to more severe conditions. 13th, constipation. Occasional constipation is a common occurrence, especially in older adults. However, chronic constipation can lead to discomfort, hemorrhoids, and other health issues. It may also indicate an underlying condition that interferes with proper bowel movement. This can indicate physical obstructions such as tumors or kinks in the intestines, or conditions affecting colon motility. If you have chronic constipation, early diagnosis can lead to effective treatment and management of underlying conditions. 14th, erectile dysfunction. While erectile dysfunction, ED, can be a sensitive topic for men to discuss, it can actually be a sign of underlying health issues. ED may signal a lack of blood flow, which indicates trouble in other parts of the body too, such as the heart and the brain. If you develop this problem, it is likely to predict a heart attack or stroke in the next 10 years, as is smoking or a family history of heart disease. Do you ignore simple health symptoms? Let us know in the comments below.